All right, and we're back on the Alabama Way. We're here with Dr. Giles, and of course, a lot of our viewers are probably saying, we don't want to see you. You just ruined our morning. You know, you're talking about these meds that a lot of us have to take just to function every day may affect our kidney. So thank you for ruining our day, Dr. Giles.
You're welcome. You're welcome for that.
Now, let's talk about, you mentioned exercise as one way that we could help prevent getting kidney disease. Is it a particular exercise such as cardio? Is it running? Is it stretching, walking?
You know, if walking was a food, it would be a superfood. And you really just need to keep moving in life. Don't be sedentary. You don't have to go run a marathon to get the benefits. It's pretty clear that right now, just keep moving, don't be sedentary, get out and do a little walking. That's probably the sweet spot for most people to get the health benefits, not just for their kidneys. You know, I'm concerned about the whole patient. You want to keep your heart healthy too. So I think it's good advice across the board.
Right. So let's talk about some myth versus facts, because there was one thing that you did mention was staying hydrated.
Yes.
So is it a myth or a fact that if you drink a gallon of water a day, that I guess it'll help your kidneys and you'll help lose weight and all of this stuff? Is that good or bad?
It's a little controversial on whether or not you need to drink that much fluid. Your brain is pretty good about telling you to drink. You know, you don't want to avoid that signal that you're thirsty and forget to drink. That's one thing. You can look at the color of your urine. If it's more on the lighter side, then you're probably hydrated, and that's probably where you want to target. You just kind of really want to avoid drinking so little that you stay thirsty and your urine stays concentrated. But you don't necessarily have to go for that full gallon.
Okay. And myth or fact, drinking sodas and lots of tea and maybe coffee or caffeinated beverages can damage your kidneys.
Okay, let's start with the sodas. We know that the sodas, especially with the sugar in them, the full calorie, they're linked to kidney stones, which aren't good. In terms of actually causing kidney damage, only if you have rather severe kidney damage already do you need to avoid the dark sodas because of phosphorus. So I would say avoid the sugary drinks anyway, because you know it could make you gain weight, get diabetes, and that's not a real good health strategy. I wouldn't say that they cause, you know, sudden kidney failure. Tea, on the other hand, is also a concern. I would say that people that drink large quantities of tea, and again, sweetened tea like we love here in the South, that's probably not good for you. And again, it's for the same reason. It's not good for your metabolism to feed it all that sugar. Tea also has some oxalate in it, and people that drink a large quantity of tea are probably going to get kidney stones, and that's something to avoid. Now for coffee, I'm a big coffee drinker myself, and I don't think that's at this point been shown to have a problem with your kidneys.
Is it because you like coffee?
No, it's really okay. It's been pretty well studied.
Well, now let me ask this then. So a lot of people, and especially down south, we like our sweet tea. So when you say a large quantity, let's define what a large quantity is, because I think I recently read a article where a man eventually had kidney problems, but he drank a gallon of tea every single day. That's a lot of tea.
I read the same article, and I remember that. People that drink moderate amounts of tea are not going to have a problem.
So moderate is what, 2 or 3 glasses?
A day, that's fine. You know, I will tell people, do the best you can, but I will tell you, you do want to avoid empty calories. If you're going to get calories, don't get it from a glass full of sugar and some tea in it. It's better to avoid that. But, you know, if you know yourself and you need a little bit, you know, I understand. Life is about moderation and balance. But you definitely don't want to drink a gallon of tea. It really takes a lot of tea to hurt your kidneys like this fella did.
Right. So what if you have the unsweetened tea? Is that better?
I would say it is better. Only people that I would have asked to avoid a large quantity of tea, like multiple glasses every day, would be people that already have kidney stones. If you don't, then that's fine.
And so would you get the kidney stones just from those carbonated beverages and teas?
You run the higher risk, you do. And certainly if you've already had a kidney stone, prevention is the best way to avoid that painful episode again.
Right. So what do you do to prevent the kidney stones?
The best way to avoid kidney stones is actually to eat less salt. See, people think they should avoid dairy, but really it's the salt that drags the calcium into the urine. If you're a big salt eater, you run the risk of higher stones. The other thing you can do is drink lots of fluid. If you're drinking lots of fluid, your urine's dilute, and there's just less stuff to form stones as it goes through. And the final thing that causes kidney stones is a diet. It's really high in a lot of meat. People that eat big meat eaters, don't eat a lot of vegetables, there's a lot of stuff in that meat that forms stones. So like phosphates and sulfurs.
Interesting. You're making a lot of enemies this morning.
Yeah, I know.
Okay, now let's talk about also what about those sports drinks and Gatorade, because it has some type of sodium in it that we think is good for us. Especially we have your athletes in the summertime, we're out sweating. Are those good for you or no?
For people that run marathons or do sports that are more extreme, like being out exercising all day as a football star, they might benefit from getting some electrolytes in with their sports drinks. And these are younger people, will probably be okay with all the sugar in those drinks. But for our older patients that are moderate exercisers, you don't really need to do those sports drinks, and you certainly don't need to do the ones with all the sugar in them.
Right. So we're going to have sodas.
Yes.
Is it better to go with the zero or a diet soda?
That's really opening a can of worms. I'll tell you, there's some link between the diet sodas and perhaps some increased risk of diabetes, things like that. Even though they don't have sugar, there's some concern they prompt our taste to want to eat more calories. I don't really feel strongly about those unless someone already has advanced kidney disease. And then even the dark sodas, I tell them to avoid the dark sodas, even if they're diet. But that's only for people with advanced kidney disease.
So I can still have my diet.
You can have your diet Mountain Dew. Yes. Life is about moderation.
That's it. Now you're my friend.
Yeah.
Now let's talk about this other. Is it myth or a fact that high blood pressure can affect or cause kidney disease?
It's a fact. Matter of fact, for the people on dialysis, it's the number 2 cause. Diabetes is the first. High blood pressure is a big deal. It takes people out earlier. It causes the kidneys to scar. And the problem with high blood pressure damage to the kidneys is you usually can't feel it. Just like you usually can't tell if your blood pressure is high unless it's just,
right,
catastrophic. You can't tell your kidneys are being damaged by high blood pressure. It really takes blood tests to find it. So I worry about high blood pressure, and we're always talking with our patients to keep monitoring it at home and to keep it under control.
So we know that high blood pressure can fall into a couple of categories. You have I think it's the pre-hypertension,
Yep.
Then you have the hypertension, and then I think it's the next one that you need to go see your doctor right away.
Yes.
So will it cause a lot of damage if you're just in that pre-stage or maybe in the hypertension stage, or any form of it can damage it?
It tends to be a matter of degree, okay? I will say that. It tends to be a matter of degree. The pre-hypertension is more of a very mild risk over time if you look at big populations of people, mainly for heart disease and stroke. Just a slight degree of kidney issues. And it's a matter of how poorly is your blood pressure controlled as to typically how severe your kidney damage is. So I just advise people to want to control their blood pressure overall so they can avoid seeing me and to avoid some of the other effects of high blood pressure.
Wow. So are there any high blood pressure medications that can make your kidney function decrease?
That's a little bit complicated. It depends. There's some unique medical situations where some of the blood pressure medications can be put you at a disadvantage. But I will tell you, most of the blood pressure classes out there, you just need to find the 1 or 2 meds that work for you. I'll be honest with you. That's really, for most people, what it comes down to. There are some different medical issues that might make a doctor lean towards one medication or another. There are some racial differences in why one medication may work better for one group than another. But ultimately, you want to get the one that works for you as an individual and control your blood pressure.
Gotcha. And so, myth or fact, is kidney disease hereditary?
It is hereditary. There are certainly some genes that we notice that make people at risk for kidney scarring. There are certainly some risk for diabetes, can run in families. And about 1 out of 20 people on dialysis has a cystic kidney disease that's very genetic. And it's about a 1 in 2 chance you'll get that if you have a family member with that. That's called polycystic kidney disease. I will tell you, if you have a brother or sister or a father or a mother who has kidney disease or is on dialysis, you definitely want to keep an eye on your own kidney function and point that out to your doctor and have them watch that.
So what if they get kidney disease via other diseases though? Would we still need to watch out for that, or just the fact that they have kidney disease could be, hey, the chances that I'll get it is great?
I agree. There's definitely some bad luck events. There's some rare diseases where I would say no, that's not really representing a risk for you. But if high blood pressure or diabetes runs in your family, you got a primary family or close family member with kidney disease is on dialysis, I want you to watch out for it.
Gotcha. Well, we're going to take another quick break, Dr. Giles. When we come back, we want to talk about kidney transplants because we know there are a number of people that's there on the list. And let's just talk about the process that they may have to go through. And also, one other important thing that you told us about is a test that we can ask our doctor about to check our kidney function. So y'all stay tuned. We'll be right back.
Open your heart.
Open your home.
Open your heart.
Open your home.
Open your heart.
Open your home. Open your heart.
Open your home.
Become a foster or adoptive parent.
To find out more about becoming a foster or adoptive parent, call 1-866-4AL-KIDS.
Brought to you by the Alabama Department of Human Resources, Alabama Broadcasters Association, and this station.
People think I'm trash, but they're wrong. Today I'm just an aluminum can, but one day I could be a stadium.
Criminal Minds on Ion Television.
Positively entertaining.
All right, and we're back on the Alabama Way. We're talking about kidney disease. And before the break, Dr. Giles, we were talking about there's some things that we can ask our doctor to check our kidney functions. And I think one of those was to check the creatinine levels. Am I saying it correctly?
That's exactly right. It's an easy test. It's a common test. I mean, any lab would perform that test. And quite frankly, if you've been to the doctor, had some routine blood work done, I bet you've had your creatinine checked. Creatinine is something that comes out of our muscles, and it's very tiny. And so we realize that it passes through the urine almost completely. So your blood level is usually very low, like under 1. So it's a perfect test to check kidney filtering, which you really can't feel. When you do a creatinine level and it's starting to go up and it's rising, or if it's continuing to go up over time, we know that that person's losing scrubbing power or filtering power in their kidneys. It's a great little marker, and it's an easy test to check.
Excellent. So when your doctor calls you back and says all your lab work is good, it probably would be good to ask them what all are you all checking.
Exactly. I agree with that completely.
Because normally I get that phone call, I'm like, thank you, all right, God, I'm going to live some more. And I never ask, what all are you all checking? Just don't stick me again.
You definitely want to know your creatinine level. For most people, a level under 1 is good. If you're a very muscular person, you might make a little more creatinine because it's produced by muscles. And maybe it'll ride in the low 1s, but that would be the normal range.
And so if you have a high level, then what's next?
If you have a high level, then you want your urine checked. You certainly want to make sure there's no protein or blood in the urine. Now that's a bad sign. But even so, even if that's not the case, your creatinine's elevated, you really ought to go consider seeing a kidney specialist and having them evaluate you, or at least talk with your doctor and see if they see that you're actually okay or reassure you. But you want to have that conversation.
And then one thing you and I talked about was when most people have kidney disease, they don't even know. So it's kind of like the silent killer with high blood pressure. So how would someone know?
Well, I get this all the time. People will come see me and the doctor has noticed their creatinine's been rising. But see, even while that's happening, you're losing kidney function, you'll still urinate normally and you won't feel badly. You just about have to need to start on dialysis for you to feel badly. So it's checking that creatinine number is where you want to catch the problem. And so when patients come to me, I talk to them about their creatinine being elevated and ways we can help them. And I explain to them that they actually have a problem even though they feel fine. And when they go to the bathroom, they think things are great.
So there's no sign in urine or anything for them to tell?
Occasionally. Certainly if you start having blood in your urine, that's a concern. But that's a little less common. And also if you have very foamy urine, lots of foam, that may be a sign you're losing a lot of protein. A lot of things can cause that. The number one cause, though, is diabetes will make you have very foamy urine. And when that occurs, it's a sign that perhaps you're losing a lot of protein in your urine and your kidney filters are getting sick.
Interesting. So, a friend of mine recently found out that her son, I think he may just be entering high school, has poor kidney function, is at 20%. For someone that may be young or have a low kidney function, what does that really mean?
Well, that's a pretty serious thing for that person. And at that time, you're going to want to screen them for what's causing the problem. You're going to get an ultrasound, make sure they don't have a problem with their anatomy. Although I'll tell you, that's not very common. Usually in that situation, it's something high up in the kidneys themselves. And we'll often do a kidney biopsy in those patients and try and see what's going on with them. And from there, you can give them an idea of what their prognosis is. You know, where are you going with this? Can I treat this? Am I looking at dialysis? Do I need a kidney transplant? But those are kind of complex discussions, but you really want to get a diagnosis as to what's happened to you when that happens.
Speaking of kidney transplant, what is the process? So is it that you have to have a kidney function at 20% or less than that to be considered a transplant patient?
See, that's a great point. A lot of people don't realize you don't necessarily have to wait until you're on dialysis to get worked up for a kidney transplant. We've had a few people go when their kidney function gets under 20%, and that's when they'll work you up. If you're under 20%, you don't have to be on dialysis. Go ahead and get worked up for a transplant. Get on the list a little earlier. And when possible, try and get transplanted before you even need dialysis.
So who's a candidate?
Okay, nowadays they'll work you up for a transplant. Typically, so long as you don't have any active cancer or something really serious that's still undergoing treatment, or if you have really severe heart disease, a bad heart valve, or congestive heart failure, weak pump, those kind of things are going to make you not a candidate. But quite frankly, most people who are getting close to needing dialysis or on dialysis, they're probably pretty reasonable candidates and should go ahead and get worked up for a kidney transplant.
And so if someone wants to be a donor, does it have to be someone in your family? Can it be a distant relative? Can you just give a kidney to somebody?
This is the exciting part of this discussion that's happened in the past few years, and I give credit to places like UAB Kidney Transplant Program for leading the way on this. You don't have to be related. Anybody can donate if they go through the screening process and they clear the health hurdles. Then they can donate a kidney, and you can donate to a coworker, a friend. You can do it even altruistically, where you just give it to somebody you don't even know. It is good to get a kidney from someone who's still alive and is healthy, but it's also good to get a kidney when you need one anyway. And so UAB is now doing a lot of paired kidney donation, where let's say you go to donate a kidney to your mom, and you're fine to donate, but you're not a match for your mom. Well, they'll let you donate to someone else who needs a kidney, and they'll find a donor and give it to your mom, all within the same time period. So while you may not be a donor for your mom, you're still able to give that kidney and get your mom a kidney and have your mom move on with her life and get over that kidney problem.
So for someone who wants to be a donor, what type of effects would they have? Because in my mind, God gave us 2 of these, so I think He wanted us to use them and to keep them. But obviously we know that you can function with just one kidney.
Well, for people that are properly screened and they go through the, looking at making sure they don't have any health problems, if you clear all those hurdles and they put you through a lot of tests to donate a kidney, then it's thought, and it looks like research shows, you're going to live just as long as someone who's not doing that. In World War II, for instance, we had some soldiers lose a kidney by being shot or injured. And they were tracked for a long time, and they did just as well as people with 2 kidneys. And that's kind of where the kidney transplant program was started, because we kind of had a sense that it was ethical to have someone have 1 kidney if they're otherwise healthy.
So you can still function, have a normal life with just the 1 kidney?
Absolutely. You've got a lot of extra reserve in that remaining kidney.
So are there any, things that you should watch out for, or side effects, or some that should jar you to say, it's because I have this 1 kidney left, I need to protect it?
Yes. Well, you certainly would want to take very good care of that kidney if you ultimately got diagnosed with high blood pressure or diabetes, because you just have the 1 kidney. And for someone that eventually developed a kidney stone, now that would be a big deal if you have 1 kidney left, because if the stone's blocking up your only kidney, then your kidney function would go down during that time. But that's actually pretty uncommon.
Wow, interesting. So how do we prevent the kidney stones?
Again, I would say drink plenty of fluid,
Okay.
eat a less salty diet, And don't just be a meat-only person. Throw some vegetables in your diet, and that'll help reduce the risk of kidney stones.
And so for those people that as soon as that plate hit the table, they're pouring that salt on there,
Yes.
that's the ultimate no-no.
That's a bad idea.
So what about the sea salt? I hear people say sea salt is better than just regular salt.
It's really not. Sea salt is just basically telling you where it came from.
Wow.
If it's still sodium chloride, if it comes from Utah, from the salt flats, or if it comes from the sea. There's really your body can't tell the difference between that salt molecule versus the next one.
Interesting. And so we have some viewers that are need more information to learn more about kidney disease. Dr. Giles, how can they contact you?
They can go online to nephrologypc.com and log in. We have lots of the little frequently asked questions, ways to get in touch with us, some links on kidney disease, and that's a great resource.
Wow, well, thank you. Once again, I feel like I know a lot more. I don't know how I'm going to feel the rest of the day eating. I'll be thinking about you as well as I'm trying to protect my kidneys as well as keep all my other issues under control. So we want to thank you so much for joining us here on The Alabama Way, and we'll be right back.